You're listening to the Turn Autism Around podcast, and I am your host, Dr. Mary Barbera. And today I have a really special guest. Her name is Beth Maloney. Beth is the author of two great books, Saving Sammy, which was published in 2009, and Childhood Interrupted, which was published in 2013. She is an expert on a condition called PANDAS and PANS, and we're going to talk all about that. But it's basically an autoimmune disorder. And Lucas had pandas diagnosed, and several of my clients showed signs of pandas and pans. So it's happening both with typically developing kids as well as with kids on the spectrum. So I wanted to have Beth on to discuss it. In 2015, the Wall Street Journal named Beth in 5 things to know about PANS, and she recently is a nominee for the 2021 Catchers in the Rye Humanitarian Award of the American Association of Child and Adolescent Psychiatrists. So this episode is all about an infection which causes and can cause pandas and PANS. So let's get to this important episode. So Beth, it's so nice to finally have you on the show to talk all about PANS and PANDAS. Thank you so much for joining us.
Well, thank you, Mary, for having me.
Yeah. So we always start with describe your fall into the autism world. And I know you're not in the autism world, but you are very much a part of the PANS PANDAS world. And so can you describe your fall into that world?
Yes. My middle son, right at the point in time that he turned 12, suddenly started having a series of bizarre behaviors. And those behaviors began with him walking around with his eyes shut, feeling as he went. And I thought it was a quirk that he would lose, but every single day for months, there was a new behavior.
And what year was this around?
This was in 2002.
Okay.
In 2002. So he ended up missing 2 full years of school. So he missed all of 6th grade and all of 7th grade. And it turned out that he had an undiagnosed strep infection, the same infection that ordinarily shows up as a sore throat or another physical symptom. I learned that in some children, it presents behaviorally.
Okay.
So that's
so he was walking around with his eyes shut, and what else was he doing?
As eventually he wouldn't walk, he would only hop. He had to hold his breath when he was ever in certain places in the home. He could not eat if anyone was breathing at the same time he was trying to chew. We had to have all of the lights on in our house 24/7. He could not flush a toilet. He could not stand the sight of bare feet. He could not tolerate the clicking of a clock on the wall, that ticking. We had to put all the clocks in closets. He thought that there were laser beams shooting out from electric outlets that he would have to climb over. He was, of course, unable to go to school. He wasn't even able to get out of the house. And this was a boy who had been totally, quote unquote, normal, never had any problem going to school. Suddenly, extreme periods of, they weren't rage, but he would be screaming simply because he was in such emotional pain as a result of not knowing what this was. Some kids do become rageful. He didn't. He had tics. His voice would jump like that in the middle of a sentence. He could only eat with a particular fork and knife if he ate at all. Eventually, he stopped eating. When he did eat, he could only eat from a certain plate. So he was diagnosed first with obsessive compulsive disorder, then Tourette syndrome. And none of the doctors who we were seeing were ever able to explain to me how this could have happened.
So suddenly, it was
So
like one
suddenly.
day it started and then it just kept progressing.
Correct.
And that as a parent, you're terrified. Like, what is this? And is it just going to continue to get worse? Is this my new life?
Right.
And you wrote the book Saving Sammy to
I did.
document your journey
I did.
with Sammy. And what year was this published?
That was published in 2009. And the interesting story behind that is that I met a new friend, a mom of my youngest son, and we went for a walk one day. And I said something casual like, Sammy was recovered at this point. And I said, after what we went through with Sammy, and she said, well, what was that? And I started to tell her, and she really couldn't believe that he had been that sick. And the problem was a strep infection. So I went home after the walk and did a lot of research. And I realized that if he had gotten sick then, which was 2007, so 5 years had gone by, we wouldn't have been any further along than we were when he got sick in 2002. There was so little information. And so I felt that the best way to get that information out would be to empower parents. And that's why I wrote the book.
Well, it's interesting because I read the book back when it was published, and I'm just doing the math here in my head really quick. So my son Lucas, as most of my listeners will recognize his name, and he's 24 years of age now. So he was born in 96. So when he was 6 years old, also in 2002,
oh, interesting,
he developed acute onset tics. One day at 6 years of age, he started. At first they were like a little shake with his head towards his shoulder. And then the next day it was adding a vocal tic to that. So it'd be like, nah, nah. And I was studying to become a behavior analyst at the time. I was a registered nurse married to a physician. And I'm like, what is happening? He had already been diagnosed with autism for 3 years. He was in an ABA program. This was clearly something was happening, like medically. So of course you're thinking Tourette's and all that stuff. And at the same time, I remember it was June, and he had kind of sores on his legs that looked like almost open mosquito bites. And I knew that he would take an antibiotic called Zithromax, and I started Googling. I guess Google was around at the time, or something was around. I started searching acute onset tics because that was very clear what it was, and came up with PANDAS. And I said to my husband, because as a registered nurse, you know, the open lesions on the leg might be like a staph infection. And then I was reading about PANDAS, which is strep. And we should define PANDAS as pediatric autoimmune neuropsychiatric disorder associated with strep. And at the time, that's what everything was called.
Correct.
PANDAS. And so I said to my husband, if this is a staph thing causing these tics, before we got him on antibiotics, it was only a 5-day dose of Zithromax. Before I did that, I took data. I actually had a clicker. It's good, I'm messy and I have a clicker laying here. I had a clicker and I had the therapist counting the tics.
Okay.
And the one day we got like 530 for this period of time. The next day we got 480. I mean, she was here for 6 hours or, whatever it was. Both days doing very different activities. It averaged at literally both days 1.39 per minute.
Wow.
That's so bizarre to me as a behavior analyst, because it was like sometimes he'd do 4 a minute, sometimes he'd go a minute or two without doing it. And they both factored out to 1.39 per minute.
Interesting.
Which made it seem as a behavior analyst in training that this isn't behavioral. There is something medical going on. As a registered nurse, I'm like, so we put him on 5 days of antibiotics. before that, also, in addition to the tics, which kept getting worse, like louder, more pronounced, maybe an arm movement with the tics, that was bad. He also got aggressive and bit me and his younger brother. Like the first time in 4 years, he actually bit us. And I'm like, oh my gosh, not only is he having these tics, now he's biting. Something is really, really wrong. And on day 5 of the antibiotics, it went down to 0. And then I finally, of course, I'm calling everybody trying to get in to see a neurologist and into, whatever I could find. And by the time I got to the neurologist, he's like, oh, it was just a stim. Like it was just your imagination. And I'm like, hello, it wasn't my imagination. Like I have data. I probably still have it somewhere in this house. And I have clinical evidence to show that it was 500 a day and now it's 0 after day 5 of the antibiotics. But you weren't thinking it was PANDAS right away.
No, you were way ahead of me because I don't have any medical education at all. I'm a lawyer. And so I started taking him to psychiatrists. And I must tell you, we went in a period of 6 weeks, we went from a totally functional child to couldn't even get out the front door. It was horrifying what we saw. And so finally got him into a psychiatrist, basically by begging and promising I'll pay cash, whatever it takes. I've just got to get him somewhere. I was talking to psychiatrists who told me, well, they do an assessment, but they couldn't treat, or a psychiatrist who would say, well, I can see him in 6 months. And I said, or thought to myself, maybe, but I might have said in 6 months, he could be dead, because that is how bad it was. And so finally got him into a psychiatrist who told me it was obsessive compulsive disorder and put him on psych drugs. And so I thought, problem handled. It's unfortunate that this happened, but it happens, and we'll give it a little time.
But the psych drugs didn't work.
They didn't work. They did not work. He just kept getting worse. And so the lawyer in me, who wants things to go from point A to point B to point C in a very logical way, would say to the doctors, this doesn't make sense to me. Why would this happen? And I could never get an answer. It happens. That's what I was told. It happens. And through a complete coincidence, he was horribly bad. And I called my mother basically to say, I'm going to have to give up. I can't do this anymore. I have 3 boys. My youngest was just miserable. I wasn't helping Sammy get better. He wasn't getting better. He was getting worse. So maybe the doctors were right, and I was going to have to put him in some sort of a placement who could address these behaviors, because I couldn't. And I was sobbing and hung up the phone. And my mother called me back and said, I need you to talk to this woman who works with me. And she came on the phone and said, have you had him tested for strep? And I said, well, he's never had strep. And she said, well, you don't know that unless you run a blood test. And
right, because most people think it's just the swab in the back of your throat, but you can get it systemically. You can get strep really in any parts of your body. And did he have strep throat, or it was just in his blood?
It was in his blood. He had never, before this happened, he literally had never missed a day of school. There was one day he woke up and didn't feel well. So I said, okay, we'll stay home. And at noon, he said, Mom, I'm better. I want to go to school. And I said, don't you think you ought to stay home? And he said, no, I want to learn. He was probably 7 at the time, or 8.
So he was 12 when he started with symptoms. Right. And when did you figure out PANDAS?
A full year later.
1 year later. Wow.
A
Yeah.
year later.
I think because I was a nurse, I was just like, and Lucas had autism. He had ABA. I was studying to become a behavior analyst. I was like, what is the function of this? And it's like, there's no function. It's 1.39 a minute, whether we do this or that. And it's got to be medical, and it's probably related to the lesions on his legs. And I started Googling. And so thank God I found it. And from that point until he was 14, he was probably on antibiotics another 20 times. Because as soon as he would get tics, we would put him back on antibiotics. So, and we worked with our pediatrician who was fine with it. I later learned from some experts that like putting kids on antibiotics like that is not a good thing. It actually, they should be on steady antibiotics and be seen and really get better. But he had vocal tics. And then when he was, I think about 13, he actually developed burping tics where he would burp 100 times an hour or 500 times an hour. It was ridiculous. And we were like, is this a sinus infection? Is this, so then I came upon a Today Show clip of a girl that was had sneezing tics, and went to a doctor up in Connecticut. So we went up to that doctor in Connecticut. Lucas ended up getting allergy shots locally. He's still on allergy shots. A big part of his PANDAS was chronic sinusitis, which is now well controlled. So it's been quite a journey for us within the whole PANDAS world as well. So when did PANDAS turn into PANS? So PANDAS again is related to strep, but PANS is pediatric autoimmune neuropsychiatric syndrome, because along the way in the 2000s, mostly because of your book and your work and you pushing people, physicians and researchers, they figured out that a lot of the PANDAS symptoms were not related to strep, but they were related to other things. So what other things, and when did that change?
So what happened was the theory of PANDAS, or the hypothesis, began around 1995. The association was made. There was something called Sydenham's chorea, which is a movement disorder associated with rheumatic fever, and rheumatic fever we now know is caused by strep. So researchers started to notice that the movements of the children with OCD and the movements of the children with Sydenham's chorea were very similar. And so then they thought, well, could these kids diagnosed with OCD who do these sort of jerky movements — Sammy also did that kind of jerky stuff, for lack of a better word — could that be strep? So they started doing research and were able to actually link it to strep. Still, it was interesting that you said that you saw a neurologist, because neurologists tend to be very difficult about this particular disorder. So because
it's still pretty controversial, and it was first kind of discovered in 1995, and I luckily found it in 2002 on a Google search. And but still today, 2021, there's still physicians, researchers who quote unquote don't believe in PANS and PANDAS. Is that the case? Is that what you're saying?
It is the case. And in fact, I want to make sure I say this correctly, the British Pediatric Neurology Association just came out with a position paper saying that there's really nothing to it. So they are even further behind than the United States, because in the United States, if you know what you're looking for, you can generally find help. So and one of the things I would say that you also had an advantage is that most parents of children who have autism, when their child presents with these different behaviors, the ones you're describing — it's interesting that you said burping, because Sammy used to sit at the table and go, it it was so nerve-wracking because it would stop and you would think, oh, okay. And then you'd start again. That, when a child has autism, is often just attributed to the autism.
Mm-hmm.
And so it's never really ruled out that maybe there is something causing this change. So you had an advantage because and not only that, but you knew to Google for acute onset. I had no idea. I had no idea. So you were way ahead.
Well, we're back when Lucas was diagnosed in 99. It was just the beginning of AOL. There was no Google yet. But once there was Google, or there may have been Google back then, because I remember one of my first searches that led me actually out of denial and into the world of autism was my search for, is it hyperlexia, or like interest in letters, because Lucas also had that. So I found the Hyperlexic Association, and I found a mom who basically told me, well, even if it's hyperlexia and just a speech delay, you want to look at what they're doing for kids with autism. And on my way home, I got a book on autism, and I was like, oh my gosh, he has autism. And so I began searching early and often for everything.
And you knew the keywords, and there was some way to search, because once I had that conversation with my mother, I was able to then go, or with my mother's friend. Yeah. Then I went online, and then I plugged in strep, OCD, boom. I found research. Yeah. So that research, I'm sorry, go ahead.
No, go ahead.
So that started in 95, but nobody really, there were few doctors at the NIMH who knew about it. The researchers knew about it, but there was no widespread awareness. Then my book comes out in 2009, and we went on the Today Show, and all of a sudden, parents all across the country are saying, hold on a second, maybe this is what's wrong with my child. So this tremendous groundswell begins to build of parents insisting that their children be treated, or that infections be ruled out. And then in 2012, there was a conference of researchers who put forth the idea that other infections could similarly cause these behavioral problems. And that was then pediatric acute onset neuropsychiatric syndrome, PANS.
So that's when in 2012, it started to switch from PANDAS only with strep to PANS, which was, and I can name a couple of bacteria and viruses that can cause PANS besides strep, staphylococcal infections, mycoplasma, Lyme disease, any others that you can think of? Oh, and now COVID. Okay, well, we're going to get to COVID in a minute, but before we do that, let me jump back, because this is fascinating to kind of hear the background information. And so I did and we're going to link your Today Show link in the show notes. And you were also on the doctor's show, which I saw with you and Sammy, your son. And so we can link that in the show notes, because I think both were really great. And I saw, and we'll link both your books as well. But because I did a video blog back maybe 3 years ago, and because I was pretty vocal about, as a behavior analyst and a nurse, that Lucas had PANS and PANDAS, and just talking to a couple of friends, who were behavior analysts, I was able to help or hear about other friends who had kids with PANS, a couple of behavior analysts who came to me when their kids, like Sammy, all of a sudden, typically developing all of a sudden, and usually it's OCD, obsessive compulsive disorder stuff going on, and tics or tics. But it could start more like walking with your eyes closed, or rages, and it can look, especially with a child with autism. And I've dealt with a number of clients with an autism diagnosis who developed PANS symptoms on top of it. And so in some ways, yes, I had an advantage because I was able to Google and I was able to put it together pretty quickly for Lucas. But most parents of kids with autism, they're just told, well, that's a stim and
Mhm.
that's Tourette's on top of it. Let's put him on another med. And these kids really unravel. And I know we talked before we hit record, the statistics, you said there's really not good research to know how many kids in the general population have PANS,
Right.
are diagnosed. You said there's been some talk about 1 in 200, but there's really no research to actually show that. I'd be interested to know how many kids with autism also have PANS, or with PANS who are also autistic, because I do think that, for a typically developing child like your son to go from completely typical to having serious, what looks like mental health issues, but it's
Right.
actually caused by an infection,
Right.
is different than somebody who's autistic and all of a sudden they start perseverating much more. I
Right.
had a friend who had an autistic child and they started ripping up papers obsessively,
Okay.
and they started sleeping poorly, and they
Okay.
started with rages or aggression. Like, it can look different. I remember one time I was in a verbal behavior classroom, and I was told that this little boy, I'll call him Nick, he was probably 8 or 10 or 12, and they said, Nick is really out of control, like, all of a sudden. And I was like, oh, really? I've known Nick since he's been like a 2-year-old. Literally, he was
Right.
in from my local area. I knew his mom.
Right.
And so I'm coming in tomorrow. I'll take a look at Nick. And they were reporting that he was peeing in the corner of a classroom. I'm
Hmm.
like, what?
Right.
And then I'm like, this is not any behavior that you would expect, but if
Right.
you have a child with autism who's peeing in the corner of a classroom, you think it's behavioral, for attention, to get out of
Right.
something. I go in there and Nick was sitting there and he was blinking really hard, really rapidly. And he was
Uh-huh.
also clearing his throat. So those are tics. So I
Right.
knew, because Lucas had it and a couple of my other clients had it, that I knew to count, to, have the school call mom, have the child taken to the pediatrician. And so hopefully this show will bring up some more awareness. You also
Right.
wrote another book called Childhood Interrupted.
Yes.
When was that book published?
That was in 2013.
Okay.
And that was published because at the time I wrote that, I had 50,000 emails from parents, and they tended to fall into the same category. So, for example, the example you just gave of Nick, who suddenly is having these different behaviors. So that is a pretty typical presentation. It might not be that suddenly they were toilet trained and they're not, although that's very common. It may not be the blinking, it may not be crawling, it may not be stopping eating, but there is a change. And so what I realized was that, and I would be answering every one of these emails, individually. And I realized that maybe what I could do is compile all that information in one place so that parents would be able to really have a book that said, okay, this is what it looks like. This is what you do. Here's how you work with doctors. Here's all the different specialties. And here's what may happen in school, and just take parents through it step by step. And it's really had a tremendous impact. Parents love the book because while Saving Sammy is our personal journey, this is just more, here's a handbook. Your child has this. Here's what you need to do.
So
And
what would a parent who's listening, or a professional, do if they think someone has PANS or PANDAS?
well, couple of things. It is primarily a clinical diagnosis, meaning you go to a doctor who is familiar with this, and they, frankly, sometimes can just observe the child for not even that long a period of time and say, I think this is what is happening. And we were fortunate because our blood test for Sammy did show the elevated level of strep titer. So certainly you could start with something like that. If blood is run, they should look for strep, they should look for Lyme, they should look for mycoplasma. But sometimes you're not going to find it. And a clinician who's familiar with this will actually prescribe an antibiotic and give it a little bit of time, maybe 2 weeks, and see if it makes a difference. And so one of the things I did in Childhood Interrupted is I interviewed, I forget, maybe 10 or 12 doctors who really treat this. And so in the back of the book are their full interviews. And the reason I did that was because I was hoping that parents could take that book to their own doctor who might not have a lot of experience in the area, but would be willing to at least read how other people treat it. And I wanted to present a variety of views because I knew as a lawyer that I could read 10 or 12 different ways as to how someone would handle a case, and one of them would work for me and get me to where I needed to be. So you have to really have a doctor who is supportive. And if you bring this up, I would say, and are immediately dismissed, oh no, that's not it. He'll grow out of it. Or she's just having a tough time. Or, well, this is autism. I think you need a different doctor.
Or this is suddenly bipolar disorder or suddenly schizophrenia.
Right.
Because that's also a risk, is all of a sudden you get like, this is it, this is a new life for you. And if it's all based on an infection that can be treated, it's really scary. I know I've gone to a couple presentations on PANS and PANDAS online and in person, and one of the practitioners, and I'm not recommending this, of course, everything we're talking about is not recommendations as professionals, but one of the experts on this said that if she has a new presentation of acute onset tics, obsessive compulsive, it looks like it might be PANS. She treats with 3 weeks of Zithromax.
Mm-hmm.
And both as a diagnostic, if it gets better, then it was probably PANS. And also as a treatment, because if you have a child that's not getting out of bed or not getting out of the house or refusing to eat, you want to see if you can fix that, at least temporarily. But there are other treatments that the child may need to go on to get IVIG infusions. There's some research on plasmapheresis. I mean, there's, maybe some kids might need some psychiatric medication on top of it. Like it's not just give them an antibiotic, and they might need steroids, which when Lucas had his burping tics, the steroids really helped that.
Sammy was so severe, he had to be on the correct psych meds for a period of time. The psych meds that we were getting from the psychiatrist in the beginning were not helpful. But when I got him to a doctor who knew what she was doing, she said, okay, this is what we need. And he needed those because he was so sick. And a lot of the more, I don't want to say the stronger, you have a better word for it, like IVIG. You shouldn't really have to go there if you catch it soon enough. I say it's like cancer. If you get it at stage 1 or stage 2, it's much different than if you're not diagnosed until stage 5.
Is there a typical age when these symptoms appear, or is it a wide range?
There's a wide range. The NIMH, I believe, has now revised their criteria to say at any time before puberty, they think. However, I must tell you that when Sammy got sick, under their criteria, he didn't qualify because at that point, they basically said you had to be 8 years old or under. So I think it really is a matter of your child. And it's important to really give yourself a lot of credit as being the person who is closest to the situation and you know your child. And if the child that you are now living with is not the same child from 2 or 3 weeks ago, I think there's a good likelihood that there's an infection that's causing the change.
Yeah. And just a couple tips there. I did a podcast interview with Dr. Michael Murray, who's Lucas's psychiatrist. He's also an autism dad. That's at episode 28. So marybarbera.com/28. We talk about a little bit about PANS. We talk about Lucas's med that he's on that has really changed his life, which is not related to PANS, but it's related to I am getting my terms confused. Autonomic nervous system dysfunction. There's a
Okay.
lot of big words here.
Right.
But the other thing I will add as a behavior analyst and a nurse and a mom of someone with PANS is if you think a child or a client has tics, especially repetitive movements, tics, something that is going up, or even peeing in the corner of the classroom, anything like that. The very best thing you can do if you're a parent or professional is if it's really rapid, like set a timer for 10 minutes and either take a clicker or just tally how many burps, how many eye blinks. You could tally 2 columns. And then also you're going to want to take a video of it because
Yep.
it might not show up that same day you get the doctor appointment.
Right.
And then also get a calendar, a physical calendar. And in here, write down 95 ticks or 95 ticks in 10 minutes or 95 ticks in an hour, a peed in the corner of the classroom, whatever your calendar says, started on Zithromax day 1, because these meds are not necessarily going to work. And then you'll be in much better shape to bring your calendar and not just have him eyeball him today. The symptoms started on November 1st, then it progressed to this, then we put him on this, then it's still here, now he's progressed to this. The calendar system is actually a big part of the 4th step of the Turn Autism Around approach. I go over it in my brand new book called Turn Autism Around. And it's really important whether or not these are behaviors related to a medical problem or new behaviors related to reinforcement that maybe have nothing to do with a medical condition like PANS. But I do think that there's a whole lot going on with both typical kids and with kids on the spectrum that is related to medical issues that is not being diagnosed. So before we go, let's talk briefly about, you said earlier, and I didn't really want to go there yet, but COVID could be a cause of PANS. Can you tell us about that?
Yes. Well, one of the interesting things when the COVID, I think most people are aware that long haulers with COVID have mental health symptoms. And when I started reading about that, I thought this sounds very similar to PANS. You have an infection. The infection is supposedly addressed, and yet the mental health systems persist. So interestingly enough, just the day before yesterday in the Lancet, there was a study published by physicians in Italy where they tracked 2 children who suddenly presented with behavioral symptoms, and there seemed to be no real explanation for it. When they traced back, they realized that the kids had been exposed to COVID, and then they ran COVID tests and found COVID. And so these although they did not have the typical symptoms of COVID, they had behaviors. And so these doctors were advocating for the fact that COVID now has to be in the differential diagnosis for PANS as another potential trigger. And
just like Lyme and mycoplasma, it could be triggered by COVID in the short term or long term.
Right. So I think that is, a further indication that there is no question about the fact that infections cause mental health symptoms. Look at syphilis. People were diagnosed with all kinds of psychiatric disorders, locked in psychiatric institutions, and they had syphilis. And it took a substantial period of time to recognize that, in fact, it was that behavior causing the mental health symptoms.
And a lot of times it's the mom or the parents, but usually the mom who is like, this is not right. Something is going on that is not right. And, in a lot of ways, the whole science of PANS and PANDAS is relatively new. It's not been around very long. And, most movements and most things that are big like this are started by parents, by moms who really are not going to take no for an answer, are not going to take, I really do think that if we look at the mental health system for kids, we would find a ton of undiagnosed PANS and PANDAS. If you look at kids with Tourette's, kids with autism, and look at the broad range of symptoms that could be, it may not, like for Lucas, it didn't do anything to his autism to treat him for PANS. I mean, he didn't suddenly get all better, and not have autism anymore, but it certainly improved his quality of life, because if he was ticking at 1.39 a minute and having aggression to the point of biting, I mean,
yes,
it is really important that we try to help our kids. And so I think this has been really helpful. So the other thing that you mentioned to me earlier, if a parent or pro wants to learn more, thinks their child might have autism, you do have a really helpful website called PANDAS, PANDAS. So it's kind of like pandas. PandasHelp.com is your website, and they can follow your work there. They can learn how to find a doctor who might be able to help treat them. And they can learn more by reading your very excellent books. I love them both.
Thank you. Thank you.
So before we go, I always like to end with part of my podcast goals is not just to help our kids and our clients, but also to help ourselves be less stressed and lead happier lives. So I know you're very busy. You're working on a third book, and you're busy getting the word out still after all these years.
Yes.
But do you have any self-care tips or stress management tools that you use either on a daily or regular basis to keep your stress levels down?
Well, for me, it's exercise. So I am always focused on being able to take a walk, go for a bike ride, or go kayaking. And that is what restores me. When Sammy was sick and my home was just in overwhelming, unbearable crisis, that wasn't always possible. But certainly as things got better, I was able to do that. And I wanted to add, I think your tip about calendars is so important, because I did that. I kept a calendar, and it was so encouraging to me because it took a really long time for him to get better. It was a full year before we were able to really get it under control. And I was able to look back at that calendar at the earlier pages and say, okay, you know what? We're better. Maybe he's not, maybe the tics aren't gone, but look how much better they are than they were. So I think that's really a good tip. And I used to sometimes just sit there and look at it, and that would calm me down. So I could see
right. You're going in the right direction.
We're going in the right direction. So that was good.
And that's part of what makes us happy, is making progress and going in the right direction and seeing things improve. So whether you have a child with severe autism who doesn't have tics or PANS or PANDAS, or if you have, if you're listening thinking, and if you're a professional out there, I really encourage you to start looking at things a little bit more with your eyes wide open, to look for PANS and PANDAS, and to check out Beth's books and her website, pandashelp.com. Thanks so much for joining us today, Beth. I've learned a ton, and I'm sure my audience has too. So thank you so much.
You're welcome. And thank you for having me.
If you're a parent or early intervention professional working with young children with signs of autism, Or if you're a parent or professional helping older children with moderate to severe autism, you'll definitely want to order my new Turn Autism Around book today. You'll get access to all the book resources that will help you right away. For all the details, go to turnautismaround.com.